Hello and welcome. My name is Sarah and I am the lead research nurse for Berkshire Healthcare. Today I'm going to talk to you about healthcare research. What does research mean to you? When I say healthcare research, it will have different meaning for different people. A lot of people will picture medication studies and their minds will leap to trials into how medications would affect them. Research comes in lots of different forms though, and medication studies are only one of them. Research might involve completing questionnaires or surveys, online, over the telephone or face-to-face. It might also involve interviews with a researcher, where you are given the opportunity to talk about your thoughts and opinions. A researcher might complete assessments with you to understand your situation, health conditions or feelings. There are also many other forms that research can take. Studies can look at how different forms of exercise can benefit different people in different ways. It can look at different kinds of devices that can help to promote physical health and well-being, but also to support people living with memory problems, or different types of therapies or interventions to help improve emotional well-being or physical well-being, or indeed different types of aids or devices to promote independent living. Research may also look at genetics to try and understand the underlying causes of different conditions like dementia. The research opportunities that we are able to provide to patients, carers and others come from a variety of sources. Ideas often come from academics, professors, students and research fellows who are based at the universities across the country. They are experts or hoping to become experts in their areas of study, and they would like to develop understanding further to enable us to have better treatments, interventions, support networks and processes. They may also come from commercial companies or drug companies who have a new product that they would like to develop for future use. However, these need to be validated by research before that they can be marketed or distributed. Finally, they might come from your care teams, from the consultants or healthcare professionals who believe that there are better ways of delivering services or better treatments that they would like to offer you. Wherever the research comes from, it is all regulated by the National Institute of Health Research, the research arm of the NHS. All research ideas are submitted and reviewed through very careful screening processes to make sure that they are relevant, that they are well designed, and that any participants are protected from harm. There are a lot of reasons that people take part in research, and we ask you to take part in research to help make the care that we give better. We need to develop better treatments and improve healthcare all the time. It can be very rewarding and enjoyable to take part in research. It enables people to have their voice heard about the way that they receive their treatments and how they are treated by their care teams. The research department is always there to support participants throughout their research journeys. We know from participant satisfaction surveys that people who have taken part have found it to be a very good experience, and for the last 2 years 96% of responses said this. Also in the last year 87% of people said that they would like to take part in more research projects in the future. Evidence shows us that research active trusts provide better care to all patients, whether they've taken part in research or not. Research helps us to improve our understanding of conditions and helps to improve treatments, interventions and services. But whilst the research department is here to let you know about the opportunities, we are also here to inform you of your rights and to protect them. It is always your choice to take part or not, and all potential participants are fully informed about what the study will involve before agreeing to take part. Asking to find out about a study will never carry any obligation. You don't have to take part if you choose not to. You always have the right to withdraw at any point in your research journey without giving a reason, and it will not affect your treatment in any way. All research teams will make sure that you cannot be identified in the reports written from the results of the research or in the results of the research. Your identity will always be protected. If you are interested to hear more about research or would like to get involved, you can add your name to our Research Interested Register. This register is held by Berkshire Healthcare NHS Foundation Trust and is never shared outside of the Trust. We use your Berkshire Healthcare medical records to understand if you are eligible for studies, and we only contact you if the study would be relevant to you. You do not have to take part if you do not want to. You can also register for Join Dementia Research online following this link. This is an online platform facilitated by the National Institute of Health Research and enables you to see what research projects are happening across the country. We can access your details from this platform to let you know about the studies that might be relevant to you. If you're interested in specific studies that you've seen in the press or from advertising across the Trust, you can ask to take part without adding your name to these registers. Your memory clinic team might also ask you if you would like to take part in specific studies that might be relevant to you. Importantly, though, there is never any pressure. It is always your choice, and you can always change your mind at any point. Thank you so much for your time and attention. If you have any questions or would like to discuss research opportunities more, please contact either myself or any of the research team using the contact details shown here. Thank you.